Hello, and welcome to the Feeling Good podcast, where you can learn powerful techniques to change the way you feel. I am your host, Dr. Rhonda Borowski, and joining me here in the Murrieta studio is Dr. David Burns. Dr. Burns is a pioneer in the development of cognitive behavioral therapy and the creator of the new team therapy. He is the author of Feeling Good, which has sold over 5 million copies in the United States and has been translated into over 30 languages. His latest book, Feeling Great, contains powerful new techniques that make rapid recovery possible for many people struggling with depression and anxiety. Dr. Burns is currently an emeritus adjunct professor of clinical psychiatry at Stanford University School of Medicine.
Hello, Rhonda.
Hi, David. And welcome, listeners, to episode 265. Today we're going to be doing a live exposure, and that other giggle you heard is our patient or
and esteemed colleague.
And esteemed colleague, Danielle Kamis, who's a psychiatrist and has been in David's Tuesday group, and she works with Matt May, our esteemed Matt May, who is also here with us and is going to lead Danielle and us through the exposure.
So good to be back with you, Rhonda and David.
It's always awesome to have you.
Good to be back with you, Matt, and good to be with you for the first time on a podcast, Danielle, and good to see you and hang out with you, too.
My pleasure. I'm I don't want to say excited, but nervous.
And this is the first time we've all been in the same room together since
Yes, we're
COVID.
in Danielle's beautiful office in downtown Los Altos, and we just had a little lunch at the Phobia cabin before coming here. So if you're visiting in this part of California, it's a Vietnamese place, and we had lunch there, and it's to die for. The food is so good. So here's a free commercial for Phobia cabin.
Yeah. Well, let me read, since this podcast will probably take a while, let me read a really quick endorsement from Rich, who wrote, I just did a daily mood log and an old issue from 33 years ago. I positively reframed it after I did the daily mood log, and then I danced in joy in the middle of my living room for about half a minute. Wow. Thank you so much, Rich.
Well, thank you, Rich. We appreciate that, and we appreciate all of the warm comments that so many of you send, and we get emails daily, often similar to that one, just with all kinds of kind comments about the podcast, about how wonderful you are, Rhonda, how we've been helpful to people. Occasionally we get slammed.
Yes.
But not very often. And the people who slam us, they always have good points, right, too.
And people also appreciate how many mistakes I make on the podcast.
Oh, that's right. That's so cool that when we screw up, people are grateful. And it's just like we learn from our screw ups. We want you folks to be trying and failing and learning from your failures, too. In fact, that's a large part of what Team CBT is all about.
Right, it's failing spectacularly and without fear.
Yeah.
Which we actually hope does not happen today.
Yes.
Well, so tell us what we're in for. I understand this will be a bit of a tune-up. One of the teaching points, one is that exposure can be tremendously effective for the treatment of any form of anxiety. It's not a treatment for anxiety. This is a big misunderstanding that people have. They think that, if you have anxiety, then you get exposure therapy as your treatment, and that's never a good idea. It's only one of many tools you can use in the treatment of anxiety, but it always must be included in the treatment package because it's impossible to cure anyone of any form of anxiety without exposure. But we've got tons of other fabulous tools as well, but we'll be focusing on exposure today. And one thing about exposure is that once you're cured, and by cure, I use the word in a serious way, which means 100% elimination of your fear, not partial improvement, a complete obliteration of your fear. But once that happens, it's almost 100% certain that fear will return. Just like when you get over depression, your depression will return at some point. No one is permitted to be happy 100% of the time. And so when your fear comes creeping back in, you want to do another exposure and another tune-up. And if you keep at it, that's the way to go. Like for myself, I used to have crippling public speaking anxiety, just horrible, really. And now I do, like right now, public speaking every day practically, and I just love it. And by doing it all the time, it keeps that fear really on the run. And Danielle, you had this most common phobia that so many people can identify with and have sought treatment for, your leech phobia. And we're going to have an exciting actual exposure. Too bad we're not on video today. We're only on audio, but we'll give you graphic visual images of the leeches chomping away on Danielle's flesh and Danielle passing out, and you'll hear her screams of terror. Tell us about your leech phobia and why you wanted to get over it, and what happened the last time around, and what's going to happen here today.
Absolutely. Well, I'll start off in sort of how we decided to do this leech phobia exposure therapy. So back, 2 summers ago, before COVID hit, I had taken a month-long trip to Sumatra to play in the jungle and with tribes there. And little did I know that when I arrived, that the leeches are not only in the water in Sumatra, but they also drop down from trees.
Wow.
And I started noticing that, I just covered every single part of my body because I was just terrified of having a leech land on me and suck my blood. And compared to the other sort of people and natives and other tourists that were there, my response to the leech and the fear was much greater than those around me. So, of course, when I was in the jungle, a little leech crept on the back of my leg unknowingly, and it sucked my blood. It dropped off. I still didn't know it. And when I looked down at my leg, I saw like a trickle of blood coming down. And I just went into complete panic mode. The leech wasn't even there anymore. And I was crying hysterically just because I felt like invaded and I didn't know what to do. So I came back home to California and decided, in my training for Team CBT, that I wanted to learn how to do exposure therapy appropriately. And, I don't like to do things with my patients without having done it myself first. And I thought, what is something that I could work on? And of course, leeches came to mind. So then I went over to Matt May, and Paul kind of described to you a little bit more about what we started doing and preparing for the leech exposure therapy. But that is a bit of a story behind how this all started.
Yeah, very good, Daniel.
So you decided to practice what you preach.
Exactly.
And that's what we think all team therapists should do, maybe all therapists in general, because if you can't cure yourself, what kind of credibility are you going to have? Well, I can't cure myself. I'm afraid of leeches and heights. That's why I have the windows boarded up, and I'm a nervous wreck. But I can help you. And so everybody here has dealt with their own demons using team, and then you have much more power with your patients because you can say, I know how freaked out you are in the case of a fear. I've sobbed in the jungles of Sumatra, as so many of us have. And I know how to lead you out of the jungle and get over your fears too, because I've done it myself. And or if it's depression, whatever, you want to know how to overcome your own down feelings so you can have credibility when you bring joy to others. So that's gives us the treat of watching something real today.
And Danielle, do you anticipate, being around leeches in your future?
Actually, I really appreciate you bringing that up, Rhonda. So that is another reason of why we chose to do this, is that I was planning on living with a tribe deep in the jungle of Papua on another island of Indonesia. So the point was I was going to do the exposure, then return the following summer. Unfortunately, that hasn't happened yet, but at the next opportunity, I'll be back jet setting on the plane there in the jungle as soon as I overcome my fear of leeches today.
To Papua New Guinea.
Papua, yes.
Papua, yeah.
Mm-hmm.
That's another famous favorite destination spot.
Yes.
I think all of us have spent time in Papua.
Yes, many of the Los Altos psychiatrists frequent Papua.
Well, Matt, can you walk us through how you prepared Daniel for today's exposure session?
Well, I don't think we hardly did any preparation really this time around. On the first time that we did this, and we were planning to do this follow-up treatment over a year ago, and that was when COVID hit, and we weren't able to meet live like we are right now. But the first time there was a good deal of preparation. Like Danielle said, I was training her in team therapy and was talking about how effective exposure therapy is, but that if we're going to be offering that to our clients, that we would have to experience it ourselves first to understand what it's like. And she identified leeches as something that really freak her out. And then we devised a number of different types of exposure to ease into that. Danielle very bravely did things like dig up some earthworms, I think, and we had little alligator clams, so we simulated a leech bite in one of the sessions.
Wow.
She would watch leech videos on YouTube. If you go to YouTube, you can see a lot of people being bitten by leeches, and so she religiously would do that every day.
Wow.
Was that anxiety provoking?
Oh, yeah, I could barely watch the screen. It was disgusting.
Wow.
Yeah. Sounds disgusting,
Big
actually.
leeches.
And she did a lot of imaginal work, including under hypnosis.
Now, people, our listeners don't know big words like imaginal.
Oh.
So give me the fourth grade version of that, because that was really important what you just said. Imaginal exposure. You did imaginal. What is imaginal exposure?
Yeah, it's to bring in images and imagine vividly the thing that you're afraid of.
Yeah.
In hopes of evoking the type of desensitization that you get through other types of exposure. And it's all done in your mind.
Right. And if you can imagine the thing that you're afraid of and it freaks you out, that's great exposure. If you imagine it and it doesn't freak you out, then it's a waste of time. And one of the principles of exposure, you have to allow yourself to get freaked out for the exposure to be effective. Now, what's the best way, Danielle, to control your anxiety during exposure? This is a trick question.
Lean into it.
Yeah. And what does that mean? It's another big word, lean into it.
It's kind of like I just throw up my hands and just bring it on.
Yeah.
Yeah.
One of the teaching points is to try to make yourself as anxious as possible, and don't do anything to try to control the anxiety. And later on, we can come back to a teaching point of the fear that most therapists have of asking people to do exposure, a fear that I myself encountered as recently as about a week ago.
Well, can I follow up with that?
Yeah.
So I imagine when you're even watching the YouTube videos and you're having body sensations like your heart's racing or your palms are sweaty or you're tingly. And I'm guessing that is probably going to happen today when you put the leeches on. And
It's already happening now. Actually.
It's happening right now.
I'm watching them squirm around on my desk.
Yeah. So is there anything Danielle can do to help her cope with these body sensations during pre-exposure and during the exposure?
I have a quick answer that you should try to make them as bad as possible. That you should not do anything to try to minimize them or control them. And that's the one thing that will make exposure fail. Avoidance is the cause of all anxiety, according to most behavior therapists. And anything that involves avoidance or escape from your anxiety, actually, that's what really makes it worse, when you run away from your fear, when you try to control it. And paradoxically, when you try to make it as bad as possible, that's when it begins to lose its power. As you know, although on the drive over here, you might have been coping with some anxiety on your own because of bridges and that type of thing that sometimes you've had some fears of in the past.
Yeah, exactly. I just asked that question for the podcast. And I read that endorsement about somebody who positively reframed a thought that he had from 33 years. And I was wondering how you reframed, Danielle, what the fear of the Leeches says about you that's awesome, or that speaks to your core values.
Yeah, so I think when Matt and I were kind of doing more of the agenda setting, we were trying to figure out, what type of response is appropriate to have for a leech, because I'm not going to be like, oh yeah, leeches, like I'm going to feed you all day, like come here, like I think it's appropriate, we discussed, to have some fear of a leech because it's kind of uncomfortable and they are kind of biting you. So we kind of decided it's not like I had to erase any sort of wanting to avoid the discomfort, but that this sort of irrational fear that I had of the leech was something that we wanted to kind of extinguish.
There's a kind of a healthy survival instinct built into our fear of parasites. They do carry some risk of disease and infection and these kind of things. So we wouldn't, obviously, I think it's very normal to be hesitant to have a leech on you.
And then, like the fear of spiders, like you have a hand jerk reaction when you see a spider. Well, I'm sure that developed from evolution, because some spiders, quite a few actually do have bites that can be, like we have around here that brown thing. What's it called?
Brown recluse.
Yeah,
those are quite dangerous. Yeah,
and the black widow, and yeah. And then, cats, you make a loud sound, they'll have a startle, and it's how they survive in nature and get away from predators. So I don't know if you can go much further than that with positive reframing with the phobia. That's a good question, Rhonda. I never thought about that too deeply.
You can talk about some interesting conversations did come up that Danielle and I had along the way. One that I recall was just wanting to be somewhat like prepared for and to do good planning, to think ahead about potential risks and in order to try to avoid them and protect oneself. And I also noticed that the qualities that a leech has are very much in opposition to the qualities and values that Danielle has. A leech just wants to take. Danielle's one of those kinds of generous people who wants to give and to help.
So that's a natural combo then.
Yeah, right. Opposites attract.
Opposites attract.
Oh, that's so cool.
Yeah, I think we also discussed like this, like what was it, like why do I have, like kind of like trying to uncover why do I have this fear other than the innate evolutionary fear, but something that was like sneaking that I didn't know, that was like
a hidden emotion.
Yeah, the hidden emotion. Yeah, that was like something that was like sneaking and taking something from me like unknowingly.
Oh,
I kind of went through that as well and talked about that.
And you all are physicians, so I imagine if Danielle had a serious reaction to the leech, you'd know how to handle it. But what about non-physician therapists who are doing exposure work? Is it wise for someone to check in with their patient's primary care physician before doing this kind of exposure?
Potentially. I think the therapist's anxiety and worry about doing exposure therapy can actually be pretty useful in the agenda setting portion of therapy, where they would ask, just kind of bring up with the patient, if we do this exposure, your heart rate could go up. What's to say you wouldn't have some kind of negative reaction to that? Maybe that would be a reason not to do this treatment. And then if the patient has a good argument and we can all get on the same page that this is still something worth doing, then I think the agenda is set and we're on solid ground together. But if I think either party has a concern like, oh, this could cause a heart attack or what have you, that it's worth addressing and problem solving and talking through. I've definitely had patients who have had panic attacks. One person in particular had recently had a triple bypass and had pretty severe coronary artery disease, as well as having panic attacks while driving. And I did talk to that person's cardiologist before we proceeded with the exposure therapy. And the cardiologist cleared them, said absolutely. I think there was even an argument that you're far better off in terms of your cardiovascular health having brief, extreme anxiety than to have this chronic anxiety over long periods of time. Like Danielle has had the past month or so leading up to this podcast. But yeah, that's a great question, Rhonda. Maybe David has some other thoughts on that too.
Well, no, my thoughts is that we've had a great theoretical discussion here and beautifully done. Since people can't see, let's just describe the environment here and then move right on into the exposure, and we'll see how freaked out you can get, Danielle. We'll try to amplify it to the best of our ability. But you two are sitting on an attractive table. It looks like a slab of wood. And then I see a couple of containers of fluid. The one with the blue top, I guess that's a little thing we would say about 2 inches high and 3 inches in diameter, a little plastic container with little slithery things swimming around in there. And then the other one is, there's another guy in there.
He's a bigger one.
Ooh, that's a big one.
Yeah,
that looks like one from the movies.
Yeah,
a bigger.
There he goes for you.
Yeah, it looks like a snake. It looks really kind of dangerous. So so we're in a square office. It's quiet in here, unlike my office, which is very hard and sound bounces around. This is kind of
and it's such a peaceful, beautiful office.
Yeah.
White walls and white furniture, beautiful art.
Yeah, the fire in the fireplace. Not. So go for the gold, folks.
Okay, I'm just wishing that we didn't eat lunch right before this.
Oh, do you have something to throw up in just in case?
Oh, I'm not going to throw up. I won't throw up. Thanks to you, though.
Okay, now Danielle is taking the blue lid off of the container with the several leeches in it.
Yeah. Now, I don't know, Matt, if you wanted to talk about what happened the first time we did this, since you thought that was kind of interesting, but how my mind helpfully played tricks on me.
But before we do that, just how anxious are you right now? I'll be the secretary.
I'm like, would you say 9 out of 10?
Oh, you're 9 out of 10 right now?
I'm well, that's true. It's going to get a lot worse. Okay, let's start with 7.
7, okay. And what time is it right now?
Well, let me get my phone out.
It's 1:45.
Yeah.
1:45, and it's 7 out of 10. I had no idea that you were that anxious.
Yeah. My heart rate's been up, and I'm kind of like squeezing my hands together and fidgeting in my chair, and I've been also thinking about this for a while. So, I knew, this guy's about trying to crawl outside the cup right now. Yeah, maybe we'll leave the cap on until we're ready.
I think we're pretty ready. Is it good for the therapist to not make faces at Danielle as she picks up the... I'm looking gross as the blood is being sucked out of her.
Yes. Well, I actually have to say, too, is that Matt is the most awesome therapist ever, and I never could have done this without him, because he actually put his life on the line and did the exposure first for me, because I could not have done it without him doing that. And so I did. I might be able to do it if you don't want to do it today, but I did ask him to come for at least support.
I think that's up to you, Danielle, whatever you would like. I'm perfectly fine to have a leech on me today.
I think that would be
kind of
nice.
Expecting that.
Okay, good. That would be nice if you don't mind.
I learned this while studying hypnosis. It's called the Chaperone Technique. If someone is really afraid of doing something, you have someone who's less afraid do it first, and that kind of shows that it's safe.
Mm-hmm. That was like hugely helpful.
Before you guys do that, has this been talked about before, the treatment of anxiety? I always mention it when I'm teaching about anxiety because I know it's been helpful for me to confront my fears in the presence of somebody who's supporting me and maybe can model the thing that I'm supposed to be doing. And we think of exposure as a pure technology, and it is, but at the same time, I think the interpersonal dimension, the warmth, the support, the modeling, the seeing someone else do it, that social piece of it, to me, can be a very important part of what causes the success, as well as the patient's courage and willingness to do this terrifying thing.
Yeah, I agree. I think just going through this process with someone and knowing that they would be willing to have a leech on them to help you out, I think is a good form of empathy.
Yeah.
Yeah.
Mm-hmm. Let's get on with it.
Yeah,
here,
I'm ready.
Yeah. Here we go.
So she's taking the blue lid off.
Yeah.
Matt is putting his arm on the table, and that's a spoon. Are you going to eat it or?
Oh yeah. Well, and also the first part obviously is like looking at the leeches. That was like, I'm at a 7. Then last time I kind of started playing with the leeches a little bit because I was freaked out to do that. So I'm kind of trying to scoop up baby leech here who just attached himself to my spoon. Oh boy, are you ready? So Matt has his arm out here. Are you?
I'm at 0 out of 10.
You're 0 out of 10. All right, I'm going to put the leech on Matt's arm. Are you ready?
Yeah.
I'm leaning forward so I can see here.
There you go, Matt. Sorry. Oh, there he goes. Oh my God! Right away. Jesus. Wow.
And
he's
how
hungry.
anxious are you now, Danielle?
Oh, he's trying. I'm at 8.5, but it's not on my arm yet. You feel him? He's doing it now. Holy crap. Okay. Now he's trying to latch on, I think. Or he is latching on.
Is he trying?
No, he is.
No, he's not doing anything.
He's not?
I mean, I can't feel.
Oh, he's looking for the right spot.
He looks like he's crawling around a little.
Well,
starting to.
Yeah, he is. No,
he's looking for a spot to leech onto.
I guess I can walk over there too.
That's his mouth looking for a good spot. This is what they do sometimes.
I don't think he likes me.
No, he will. He's trying to find something good, maybe.
Oh, he's stretching himself out.
Oh, God, it's disgusting.
You might put a little more water on my skin, probably.
I should have brought a thing to prick your skin with.
I have one.
Oh, you have one here?
I do, but...
You could do that.
Holy crap.
Yeah, let's do that. Then he can kind of drink your blood.
Where did I put that thing for the...
Oh, there he goes.
Did you get it? You okay?
Oh, there's nothing happening still.
Oh.
Yeah, it's just wandering around.
Gee, watching that leech on you, Matt, my anxiety's going down.
Your anxiety's going down?
Yeah.
Okay.
Well...
It just looks like a little black worm.
I'm trying to think.
Who's kind of looking around. Ho, ho.
You might twist that to get it off.
Oh, you're right, David.
How anxious were you, Rhonda? Were you pretty anxious?
I don't want to do
about
this to
4
you,
or
Matt.
5.
I don't want to do this to you.
It's
Does
just
it
like
have
a
a cut? Do you caulk it?
He's trying now.
Oh, he is now. He found a spot. He's doing it now.
Oh, he is?
Yeah.
I'm holding very still.
He's kind of like...
Oh, I can feel it.
Oh, how bad does it hurt?
No, it doesn't.
And so we're just looking. It's like a little short black worm
Okay,
on his on Matt's forearm, and then there's 2 others in this plastic container with some water in it.
Yeah, he's going to town now.
Oh, he is.
Mm-hmm.
Does it hurt?
Very mildly.
Mm-hmm.
What does it feel like?
It hurts less than an injection or.
You can see he's filling up with Matt's blood now. So whenever you want Matt, we can take him off with you.
Well,
I'll just
give him a good drink.
Yeah,
he's thirsty and hungry, right?
Mm-hmm, right.
Oh, we didn't clean your arm off anyway. Okay.
It's fine.
Now you will bleed because they release a blood thinner.
Why don't I just keep him on until he's done, and then you can go when you're ready.
Yeah. Yeah, we'll have you.
You want to leave him on there? He can drink for. He can be there for.
Bimodal leech therapy.
We might bleed more.
We do two arms at a time.
Are you kidding?
So he's not ready for that yet.
Okay,
Danielle was opening a Band-Aid.
I'm preparing it for him.
And Matt's just so calm and.
It doesn't hurt.
Doesn't hurt.
I'm feeling really
It kind of
nauseous
tingles.
watching it.
It's interesting.
This
It's
is gonna be-
kind of like an electrical feeling.
Okay, now don't you need your arm here?
Am I going to put it, Matt, can you put it on me?
I can try.
Yeah.
We need Spencer
They're a
Tracy.
little.
You can put your arm down like this.
So now Danielle's...
How anxious are you now, Danielle?
I get very nauseous and I'm really anxious. Maybe just get that guy. He's about to come off the thing.
Oh, yeah, he'd be easier, huh?
Yeah.
So
I just feel like really, yeah. Kind of how I used to feel like before as a med student going into the surgery rotations. I think he's more active as my leg. Okay.
There we go.
Yeah, so Matt scooped out a leech on the spoon.
Did you want to use some alcohol on your skin?
Okay, thank you for reminding me.
Although you said these
won't
are
like that.
They're medical grade leeches, right, Danielle?
We're just gonna take the bacteria off my arm in case I have any. I can use some leech or whatever. It'll probably evaporate. Okay, you might not like it though. You're right.
Okay, let's get.
Oh God, wait, really?
Why don't you control it? I think
down.
it's easier if you do the.
Really? I don't know if I'll do it then. But okay.
So Danielle is holding the spoon that has the leech in it.
Look out.
No.
There's one on your finger now.
No, Matt has purposely put a second leech on his finger that was crawling out.
No. Okay, good. Here we go. How anxious are you, Danielle?
I'm so anxious.
Are you 100, Danielle?
Yes.
What's your 0 to 10 score?
Well, it's like 9.5 until he gets on me, and I can't get him off the stupid spoon right now. Here he goes. All right, here we go. Go, buddy.
Yeah, so he's crawling off the spoon onto Danielle's arm.
Whoa.
Oh, now he's on the arm.
Now he's on Danielle's arm.
Oh, very good. He's just sitting there, though.
You're doing a great job, Danielle. Very brave.
Thank you.
What's your anxiety level?
It's 9.5.
9.5? You're doing great. Can you push it up to 10?
Is he doing anything?
No, he's looking.
He's elongating himself.
Yeah, the butt sucks on. There he goes. Let's see. I think
he's searching for a spot.
No, I think he's.
Careful with your right hand so he doesn't fall off.
I think he's doing it now, but actually.
Oh, great.
It actually doesn't hurt as much as last time.
Do you want some help with that, Matt?
If he's.
No, I'll just let him do what he wants to do.
Okay.
How much does it hurt between 0 and 10, Danielle?
It actually doesn't. This one doesn't hurt. Oh, wait, let me see. Oh, now I can. Oh, now I can feel it.
Can you describe what it looks like, Danielle?
It's like a. It's like a. Ow! Now it's hurting a little bit more. It feels like kind of like a suction cup and sandpaper on your skin at the same time.
Mm-hmm.
And it's like a. I can see boluses of my blood going into him. So there's like 2 little boluses in this little leech that's on my arm right now. But I feel. I don't like it. But
How anxious are you right now?
it's like a 9 still, I think.
You're doing a great job keeping that eye contact and just staying calm.
I think
Does anyone know what time it is?
Yes, it's 5 minutes to 1.
1:55?
1:55.
Okay. Well, the better thing about this one is I can't feel it as much.
Oh, yeah. You're going to make a video of it? Then we could post that on with the show
We can
notes.
make a video if you want to. Yeah, or photo of video.
We're blood siblings now.
I like that.
You making a video, Rhonda?
First, I'm just taking pictures that they can...
Yeah, but if you make a video, too, I can post that.
Yep, I'm making a video.
So people can see...
You can see if you... Yeah.
See the arms and get Danielle's face and Matt's face. You're doing great, Danielle. How anxious are you right now?
It's going down a little bit because he seems just to be chilling there, and I don't. It's like a 7, 6.5, I would say.
6.5 to 7, and what's the time now?
1:56.
1:56. Okay.
How did we get into this mess, Danielle?
I don't know, Matt, but I don't think I could do this without Matt doing it with me. He's you go in and that guy is really filling up with your blood.
Yeah, that's impressive.
Do you want me to take him off you yet?
Not really.
What's the one on your hand doing, Matt?
He's also biting into me, but is smaller, so I don't really feel that one that much.
Well, they do their thing quickly. Is there a leech on top of that container? Or
I think that's just a spoon.
a spoon? Oh, that's the spoon.
Yeah, my guy's just doing it real slowly.
What's your anxiety level now, Danielle?
It's definitely less because it's not hurting. I don't know, like a 4 or 5.
Okay, and what's the time?
It's like, let's see on the
It's just
phone.
about 1 minute later.
1:57?
Yeah, I'm sorry, it's 12:56. I said 1:50 before, and it's 12:56.
Okay.
Actually gone back in time during this exposure therapy.
Is the main thing that's reducing the anxiety that it's not hurting, or?
Yeah, I think I had a huge fear because I didn't know what it was going to, I can feel it right now, actually. It hurts a little
Kind
bit.
of goes in waves, doesn't it?
Yeah, ow, it hurts a little bit now.
But isn't it kind of anxiety provoking because it's so gross looking?
Well, they are gross, but I've been looking at them when I was like exposing myself watching them for a long time, so I've kind of gotten over that at the moment. I think I didn't know what it was going to feel like the first time, and that made me I was really frightened, and then it ended up actually hurting, so I was actually pretty scared this time about how much it would hurt again, but this one just feels like a fine sandpaper kind of rubbing against my skin right now. And
Is there anything else we should be recording, like the pain level or anything else? All I'm doing is the anxiety.
whoa.
We could record
watch your blood coming in there. It's crazy.
pain levels. I'd say the pain is less than a 1 out of 10.
Yeah.
Yours is less than 1, and yours is
Mine's
also...
I would say it's like a 1 to 2. I can definitely feel him right now. It's just like, yeah, it's uncomfortable, but not hugely uncomfortable. I'm kind of getting gross because Matt's Leech is like filling up majorly with his blood.
Yeah,
You can
Matt's
see it
pretty happy
getting
Leech.
larger.
Oh,
Oh
yeah.
yeah, he's like
Matt's
tripled in size.
Yeah, Matt's Leech has definitely gotten bigger.
Oh.
Mm-hmm. I'm feeling a little faint and lightheaded. Is that
Yeah.
normal?
Now you have to watch the movie The African Queen.
Oh, yeah. That was a good Leech movie.
Yeah.
I haven't seen it. That could be your homework, Danielle.
Oh really?
That was a classic.
Yeah. With Spencer Tracy, I think.
With Humphrey Bogart, right?
Oh, Humphrey Bogart, yeah.
Yeah. I remember one of the things that Matt and I talked about was kind of imagining like as if I was getting like an IV in my arm. We kind of thought about it like that. Like, yeah, that I just imagine like that I'm getting an IV and getting my blood taken out. I'd say my anxiety's better, but I'm feeling pretty nauseous right now.
What's your anxiety right now?
My anxiety is just, I think I'm probably like at a 4 to 5 still, but I'm feeling like nauseous.
Do you want a second Leech?
Absolutely not. I think my goal for 1 is a good one, but yeah.
How nauseous between 0 and 10?
I'm feeling pretty nauseous, like I don't know, a 6 or 7. I'm pretty like sweaty and nauseous, I would say.
Are you feeling sweaty and nauseous, Matt?
I am not, no.
How anxious are you, Matt?
0.
0.
Yeah. I'm not sure how to get the nausea to go away.
I was recently on the 31st floor of a hotel in Waikiki, and my anxiety was a 10 out of 10.
Wow.
Yeah, my fear of heights is back. And I
Yeah,
need to,
mine is too.
Is it?
Yeah.
So I can sympathize with what you're going through.
Thank you.
Oh, yeah.
Me too.
Yeah. I think I should have used the extra strong deodorant today because I'm schwitzing.
You're sweating?
Yes.
I know, Danielle, I can smell you from over here.
Yeah. Well,
While you're doing that, can just so we fill up a little of the time for our listeners, one of the issues I mentioned as a teaching point is the fear that therapists have, and so most won't use exposure. And there's even a lot of sectors within the mental health movement that are kind of anti-exposure, people who really badmouth that and say, it's dangerous and all of that. And I've been working with this woman in Europe who has a number of issues, but one of them is she kind of has panic attacks brought on by her fear of committing suicide. And she has no desire to commit suicide, but she's afraid that she'll just do it impulsively.
Crack up and lose control.
Yeah. And so I felt like she really needed exposure, but I didn't feel comfortable doing it across the Atlantic Ocean, where there's no one to support her personally.
Right.
But after, I had her get a local therapist, but it's not very aggressive therapy, and so I finally just decided to go ahead and do it with her on a Zoom call, and it was very intense, and I found myself feeling anxious as well. And I had her go through a scenario of committing suicide. It was just terrifying to her. And she jumps out of this building, and then she can see herself smashed on the ground, and the people are coming and talking, and the police come, and and she could see people at her funeral, and everyone saying, "We had no idea," and all of that. And she was sobbing, and her anxiety was just up, in the 100 level. But sure enough, it came down to about 40 the first time we did it. And then I gave her the assignment to keep doing it on her own. And now when she does it, she can get her anxiety up to 30% or 40% on rare occasion, and then it goes all the way down to 0. And so it's, you are rewarded. It does take a trusting relationship, like you guys have a trusting relationship. And I think that really helps a lot. But it's also sad that so many people won't use exposure and don't really grasp it or appreciate it. And with that in mind, I think Danielle passed out. Can you just slap her around a little bit, bring her back to how
some water on
anxious?
her.
Yeah, how anxious are you feeling now, Danielle?
Well, I think you changing the subject and not me only focusing on the leech actually helped me. So the nausea has definitely gone down. I think I'm back at one or two of nausea, one of pain, and my anxiety is okay. I just kind of I want to get the leech off of me, but I'm not.
What's your anxiety?
Yeah.
Between 0 and 10?
Like a 3 or 4, which could be an appropriate amount of anxiety.
And it's 104. The time is 104.
And what's your nausea?
It's like I don't have it. It's low. It's like a 1 or 2.
So, is it advisable now? We'll ask our guest experts, Rhonda, Matt, and Danielle, to take it off while it's still. Of course, you're in control. While it's still 3 to 4, is it better to bring it down to lower, bring it down to 0?
Well, yes, it's not. I don't want to reinforce the fear I have, and this is. It's nice. I can see my blood trail on my arm. That's disgusting. Gross.
Oh, mine's wandering off too.
Oh, he's done now.
Yep. Looks like he's full.
Well, since your anxiety is 0, you can put it back in the water if you want. If you're mad.
Is your anxiety 0, Danielle?
If yours, Matt, has had a nice meal.
Yeah. What should I do with the?
Let's put him. We're going to use this again. So just put him back inside.
We might use that one though, right?
Are we doing more? Then put him in here.
Let's.
Or what do you want to do?
Do you want me to take it off and put it in here? Seems satiated.
Is there another container?
I didn't bring.
Because we could do the big one too.
Oh, I do not. Are you going to make me do the big one?
Can I see your arm, Danielle? Oh yeah. So he left his spot.
Yeah, I think he's sleeping
This
now.
one is still going to town. This guy is still hungry.
Well, I have the container some more soup in it.
You don't want to mix those up.
Here. Maybe actually, I can use this.
Okay, I've got this guy.
Here, Rhonda, would you mind opening that bottle of water?
Boop.
You can put him in there.
Do you want him, or do you want me to do it?
Oh, I do not want that on me. Hell no.
Okay.
God damn, that's huge. It's so big. Is there a leech in here? No.
Not yet. So
Should we keep recording, or should we turn off the recording at this point, or what do you think, Rhonda?
I think mine's done.
maybe we should turn it off and then come back onto it.
Okay.
Can we do that?
That sounds fine.
Well, I don't know. Maybe we could get, when we get down to 0. We could also keep it on.
Mm-hmm. What's the plan at this point? How anxious are you now, Danielle?
I'm not anxious because he's not biting me anymore. He had his
going to
meal.
fall on the ground.
So you're not anxious now?
Oh, so you're at a 0? For real?
I'm at like a 1.
At a 1? That's cool.
And maybe that's appropriate.
Yeah.
Because you don't want to be in love with leeches.
No, I don't want to be in love with them. Look, he's trying to say hi.
Oh, yeah, he's going, hi, Danielle.
So how do you feel about what you did just now, Danielle?
I am relieved, very relieved that he's going to crawl maybe off my arm.
Do you want some help with that? Ooh. So we're trying to put the leech into an old sort of water bottle.
Did he get a meal?
Yeah.
Oh, yeah.
This one did too.
Do you want
Use
this in
ones
here?
and go in there.
Yeah.
So there's that one that didn't. So now Rhonda is busy putting the
leech
fed
back
leeches
they're crawling out. He's like, hey, I don't like it in here.
Bottle container with water in
that guy
it.
had you for a long. Oh, he's really going. Oh my god, that makes me nauseous looking at that again, though.
Oh, maybe you should look at it a little longer.
Oh my god.
And
It's
what
huge.
is
The
it?
one Matt put on his arm was about 2 inches long before it started.
Is it still there? Or?
Oh yeah, Matt's.
Is he sucking? No, what do you do?
You can go look at it.
It's kind of like phallic, don't you think? I mean, I don't want to get like Freudian, but. I'm really glad you have clothes on, Matt.
Wait, I'm gonna get the blood. It's right. Wait.
Yeah. So it's gotten
Gosh,
a bunch bigger.
It's like almost
This is actually
3 inches long.
this one has not eaten yet. This is the big one that we're kind of wondering if he's going to do anything or not.
Oh, okay. So let's see your arm. Yeah.
Oh.
I don't. Yeah.
Yeah, he's good.
Maybe we could say what it's like now that it. Dang.
Yeah,
No,
then
it's
we
latched
can
on.
kind of wrap it up because this might not be that interesting,
Here's
this
the
part
nail.
for our listeners because they don't know what's going on.
Or slide your
They're
nail.
just
Yeah, that.
taking a leech, the last leech off of Matt's
Danielle.
arm, and it just
And
fell
it
off.
fell.
It's not
Get that
crawling
leech
around,
off
yeah.
my office floor. Put it underneath the.
Where?
The
Where is
rug.
it?
Oh, there it
Ew.
is.
It's
There
getting
it is.
away.
Yeah. That's
Matt's grabbing it with a spoon and a fork.
Oh my
Okay.
god.
Now put it
Looks
back in
like-
the water.
Okay.
Okay.
It prefers your
Does
arm.
it for your
Okay.
blood here?
Now all of the
Now all of the leeches
are
are
safely back into their
into some environment.
water containers, and 3 of them got to eat. 3 of the 4 got a nice meal.
That's right.
So
No leeches were harmed during this podcast.
No,
What to
they-
say?
Quite the contrary.
So, tell us now what your thoughts are, Danielle and Matt and Rhonda.
It really sucked.
I feel like I had a lot of apprehension and feel a lot of relief that I was able to do that.
Oh, thanks.
Tell us about that a little bit, Danielle.
I'm just sorry, I'm just watching the blood ooze out of my arm at the moment. But I think that I was just trying to, like, when the leech was biting me, I was trying to imagine, like, being in the jungle, because, like, you know, going back to Papua and just having this leech on me, and I was imagining, like, that it was kind of just like an IV that was taking my blood, something that, you know, I'm fine with, and I think that I noticed that as the pain went up, my anxiety went up, and as the pain went down, it went back down, but I feel proud of myself. I feel relieved. I feel grateful that Matt did it with me. And I feel like I could go to the jungle. I think I would have a healthy amount of aversion to the leeches, but that if I saw one on me, I kind of know what it feels like. I don't think I would I wouldn't consider it a phobia anymore. Or I don't think I would have like a crying spell like I did before.
Would some homework and relapse prevention therapy to repeat this imaginally or in reality, but with imaginal exposure, just to imagine, leeches all over your body and see how anxious you can make yourself, and keep doing that until it's impossible to make yourself anxious?
That does it. Yeah, leeches all over my body sounds pretty terrifying. I think when we found that when I was doing the imaginal exposure, that I could get my anxiety up to a certain degree, but it wasn't the same as obviously the live exposure.
Oh, this was more powerful.
Yeah.
Yeah.
This was more powerful.
That makes sense. I mean, you have the leech right in front of you.
Yeah, I can still see it squirming around, doing its thing.
Would it be desirable to do then for homework more exposure on your own with these leeches?
Probably. I probably could. Next step would be, I think, great, like doing it by size. Like I had the baby leech on me, and Matt ended up putting on a large leech. So I could probably, if I wanted to start increasing the size and time. And yes, I think that over time that I needed to re-expose myself again, because it had been about a year and a half, and my fear had kind of redeveloped. Not to the same extent. I think I made huge progress just the first time doing it, but even a year and a half later, I needed some more exposure to prevent the fear from creeping back.
So is that a yes or a no?
Yes.
Okay.
More exposure, more homework.
Cool.
That was a long way of saying
Yeah,
that.
yeah. Well, what are we talking? I kind of lost track. Wasn't there a question there? Good. That's great. Well, we're really proud of you, and appreciate the chance for all of our listeners to hear actual exposure going on. And I would say that for the most part, there isn't anything more to know about exposure.
Right.
Really, I mean, this was kind of like flooding, where you go for the worst. You can also do gradual exposure, just kind of like what you were talking about. Do bigger and bigger leeches, but it just something that you do, and you just stick with the anxiety. And the thing is that the anxiety cannot stay with you indefinitely and forever. One of the distortions you get into with phobia is that you've got to get away from this, or the anxiety will go on and on and on and on. And one of the neat things about exposure is that your body just can't be anxious that long. I remember a story I've told so many times when I was in the Highland emergency room for the first time. And they brought in this bloody guy, and I had this extreme blood phobia, and I had to go up and clean the gunpowder out of his wounds, and I was just like freaked out for about 30 minutes, just 100%, 10 out of 10, and then all of a sudden, just in 10 seconds, my anxiety went to zero, and I wasn't afraid of blood anymore.
And then was that permanently gone?
Yeah, pretty much. And if I hadn't had that fear of blood, I probably wouldn't have gone into psychiatry. I would have been a trauma surgeon or something like that, because that was so much fun working in the emergency room. And
well, there was benefit then.
Huh?
There's benefit then to the fear of blood, because we're very glad that you went into the field of psychiatry.
Yeah. Well, any parting words of wisdom or inspiration or genius from anyone? Why don't we start with, who should we start? Should we start with
I just want to say
Matt?
I'm really proud of you, Danielle. I was a little apprehensive, but kind of gross to say, but it was a little fun to watch. And just your grace under courage was wonderful.
Aw, thank you, Rhonda. That's so sweet. Yeah. I just want to encourage anyone out there that if you have a phobia, you should go for it. And, sometimes facing your fears is the best thing you could do for yourself.
Cool. Have you been able to take this wisdom into your clinical work, Danielle?
Absolutely. I get to use my Leech story all the time with my patients. If they're scared of doing something or doing an exposure themselves, I kind of use this story as look, this was my experience. I know what you're feeling, but I also know that you can overcome it and let me walk through this with you. Kind of like.
Have you done exposure with your patients, leading them through their fears?
Absolutely.
Oh, cool.
Yeah, absolutely. Yeah.
And Matt, we'll leave the parting words and the greatest words. It's something everyone's been looking forward to you.
Well, I'm just thrilled that we have proven once again how medically useful leeches can be. And there was one part of the initial treatment that I recall very, very fondly. It's when it was about a week before we were scheduled to do the live exposure to leeches. Mm-hmm. And do you remember our conversations then, Danielle?
When I was telling you that I wasn't going to do it?
Yeah.
Yeah, I remember that.
Yeah, I was just really encouraging of you not doing it.
Right.
And that helped kind of ease the tension. And then you ultimately decided that you did want to do it.
I did, yeah. I became so anxious that I decided I wasn't going to do it. And Matt was telling me how I didn't have to do it. So then I decided I actually brought the leeches in and said, Matt, here are the leeches. We can look at them, but I am not putting that thing on my arm. And he's like, that's okay. You don't have to. And it kind of like protected me paradoxically. In the meantime, when I was waiting in the apprehension, I tricked myself to thinking that I wasn't going to actually do it. And then we sat down. Within 2 hours, I had overcome my fear in that moment of the leeches.
Yeah, right. And that's an important strategy. My strategy is sometimes the opposite. When it comes up to the point of the exposure, the patient will usually put a lot of pressure on the therapist, to back off. And then if you say you don't have to, then the patient does back off and they get worse. Mm-hmm. So I often go in the opposite direction of telling them, no, you are going to do this and you're going to do it right now. But you have to have a good relationship with the patient to push them like that. That video of the jumping jacks is a perfect example, that she was begging me not to have to do jumping jacks to test her belief that she was about to die of a heart attack. Mm. And I had to push her real hard. So, Matt, what would be the wisdom on when you should paradox a patient the way you did gently with Danielle, or maybe you have the answer, Danielle, and when, like, what I sometimes do is I out of a loving goal, I push the patient and I don't allow them to back off.
I'll be pushy like that too once I have permission, and we've talked about how that will happen. Yeah. That when we get right up to the point of facing the worst fear, that's natural. That's how people will behave. They'll want to get out of it. Yeah. And it's helpful to have someone there saying, no, absolutely, let's face this fear right now. Yeah. I'll even do it with you. Yeah. And then I think the reason I used paradox was that there was a long period of time leading up. There was about a week before we were going to do it, and wanted to I felt like there was no need for me to be pushy in that moment.
Yeah. Cool.
Well, shall we say thank you, everybody, for listening? And I wish it had been a video so that we could have seen the look on Danielle's face. But we did create a video that David's going to post in his show notes.
Yeah, and we might have some photos for you, too.
Thank you all.
Okay.
Thank you.
Bye-bye.
Bye-bye.
Thank you.
Bye-bye. Thanks.
This has been another episode of the Feeling Good podcast. For more information, visit Dr. Burns' website at feelinggood.com, where you will find the show notes under the podcast page. You will also find archives of previous episodes and many resources for therapists and non-therapists. We welcome your comments and questions. If you want to support the show, please share the podcast with people who might benefit from it. You could also go to iTunes and leave a 5-star rating. I am your host, Rhonda Borowski, the director of the Feeling Great Therapy Center. We hope you enjoyed this episode. I invite you to join us next time for another episode of the Feeling Good Podcast.